smile evening to each and every one of you. A heartfelt welcome from all of us of Joshi's Kerala group. We especially are so much grateful and deeply appreciate our Bhupinder ma'am, International Sujok Association from, who has been spending so much time with our group for giving us free sessions on Sujok, Try Origin, and Smile meditation from so many years. So, ma'am, we are so much grateful to you for your time, dedication, wisdom, and knowledge. And I just can't, I would just say etc. because I can't even specify those words. So, a smile evening to you, ma'am. And we are blessed to have your presence in this particular group, giving us so much knowledge, wisdom, and for especially sharing all of them with all of us. So, a smile, starting with this session with a smile, gratitude to you, ma'am, from all of us, from all of our hearts of Joshi's Kerala group and its members. A smile evening to you, ma'am. Please take over the session. Thank you so much.
Good evening. Thank you so much, Anusha. Rather, I'm honored to be here. I love this group and I really feel happy when I share, and especially when you get result that is really great inspiration for me. Oh, so we'll start our session. Last session, you remember, we were discussing about knee problem, knee joint, because that is very common these days. Yes, joint problem. Though I have discussed a lot of time, but now I'm focusing in detail so that you can really take care of your knee and you can see the result. Yes, you can do step by step. In last session, I have discussed all points like as per basic system, standard correspondence system, insect system, mini system. Then we discussed new topic that was law of reflection theory, and then tri-origin knee points. Yes, and as I said that it is not important that you do all the points at one time, but you should know everything. You never know that some patient can get result from the basic system. Some people they get result just with one fenugreek seed, just one fenugreek seed applying on the mini system. Sometimes just color therapy works like wonder. Sometimes triogen treatment like this. So you never know. Yes, many people with different consciousness, and disease comes from the consciousness, variety of emotions, variety of thoughts. And each system under Sujok is connected to our consciousness system. Like in Triorgan, we say hetero-consciousness, homo-consciousness, neutro-consciousness. People, those who have a lot of hetero-consciousness, their disease is reflected in, hetero manner. If person is having homo-consciousness, then disease is reflected in homo manner, like this. So that's why it is good to know all the points. And sometimes with smile, with pure soul, just one treatment, and that is called soul treatment. Yes, just one dot can cover all kinds of consciousness, all kinds of diseases related to variety of consciousness. Okay, so I am teaching from beginner point of view, slowly and in a simple way. So what is the first step? Okay, now we know the points, and in this hand, as per basic system, you know that middle two fingers and middle joint are knee points. We know actually, all people know this. This these days, this basic system is very well recognized and very popular. Many people know even without studying Sujok, just by seeing the pictures they know. But still, out of 10 people, 5 people are getting result and 5 people are not getting result. So we will solve all these situations to experience 100%. Of course, one thing I always say in my session, to modify lifestyle along with Sujok point. Don't forget good diet, exercise, pranayam, yes, morning walks, and smile more. This is very important, and also good food. Uh, and especially when I talk about food, it is very important to understand that if we have any disease, then we should eat that kind of food which has healing powers. Simple thing. I'm not talking about veg or not veg. It's not that thing. You pick up that food which has healing nature, you know. So plant world, you can add more this kind of food in your diet. Whatever you are eating, it's okay, but add more healing foods like fresh foods, vegetables, yes, and then nature, of course. So all these things you have to keep in your mind along with your Sujok point, and then you will see even in 90s and 100 age also, I have seen people have good knees, good strength in knees. They are walking, they are doing aerobic. Then you can see in the Google, you can see how old people are doing exercises and Tai Chi. Why? Because they are maintaining all these parameters. Okay, so first step is simple, very simple step, very simple step. That is ring massage. You all know, but we will do it very systematically. So I always advise my patients that when you do ring massage, of course, you have to focus more on the target point, like these are the knee points. Yes, but after studying reflection law, you have understood that many joints are connected with the knee point because there are many reflection points, shadows of main knee. Yes, multiple joints have this kind of information. So better without taking reflection points, you do ring massage on all the fingers, but knee point is in the center of the finger. So all middle joint, as per the reflection theory, all middle joint, you should do good ring massage. For example, patient has right knee pain. Yeah. So I choose right hand first as first choice and middle finger middle joint. Always we see like this when we are focusing the body parts below the diaphragm like this. So but to understand we are doing like this, but when we are doing practical we can keep our hand direction in any comfortable uh, posture. So now you see this is the main point. You can start with this nicely, and when you do this ring massage, do it press from all four direction like this. Yes, and then like this because it has four direction: left, right, back, front. Yes, don't press very hard. This is the biggest mistake we are doing. We press very hard as if like we have this kind of mind. If we press more, it's like acupressure. If we press more, then we will get quick result. No, it is not like this. Why we are doing ring massage? We are creating frequency on the skin level. You know, all this energy network is um, main on the skin. Of course, energy is everywhere in the body, but skin energy network is very sensitive, very sensitive. So the point, and from the correspondent point of view, knee point is on the surface level, but not on the bone. It is not in the blood. It is not deep. So don't cut your skin by giving good deep pressure. So gently, you should enjoy your ring massage. That is why I always say that whenever you are watching TV, your hands are free. Yes, you do something, whether you can do ring massage or you can do twisting of fingers. Yes, exercise of fingers. Hand has representation of full body. So don't miss this free time when your hands are free. Yes. So this is kind of, now I am demonstrating on one joint, but you have to do it the same thing on all the joints. Yes. So do this ring massage nicely until your skin becomes warm. Yes. And then one by one, you can massage all the middle joints. This is, for example, my right knee. Here I'm giving more attention, but then I have to focus additional supportive points. Yes, as per reflection theory, all center joints. Sometimes you will experience just with ring massage pain is gone. In new diseases, yes, you do ring, you teach your patient properly how to do ring massage and pain is gone. It is not it is not necessary that to find painful point every time you need to find the painful point. If these painful points are floating on the skin surface, then just with the ring massage, this knee pain will go. Yes, so you do it on all the middle joint, especially when knee pain. Of course, additionally, you can roll on all the joints because we have, 72,000 nadis, and it is very powerful energy network. So all ending points of these nadis are here on the fingertips. So that is why stimulating all these fingers additionally will enhance your treatment. Okay, so this kind of ring massage. And then second thing is, uh, these are simple baby tips which you can apply in your daily life. So when you are in your office or in the market and you don't have this ring, your hands are free, you're waiting. Yes, you're waiting for someone, or in airport, in station, or somewhere where you feel that you don't have anything to do and you have to wait. Better you play with your fingers. Yes, this is like a game. Play with your fingers. How to play with your fingers? Become like a child. Your hand has tremendous healing power. Sometimes when you do this kind of techniques, baby tips on your hand, not only your knee pain is healed, but many other things are solved if it becomes part of your daily routine. So play with your fingers, for example. See how to play with your fingers. Yes, joyfully, as if you're doing nothing. Let it become part of your body posture. You just do it when you're talking or you're free, clockwise, anti-clockwise. This is called skin twist. Professor Park Chebu, he discovered twist therapy because our body has beautiful spiral energy network system. Yes, and people are doing Tai Chi to stimulate this spiral energy network system. They are doing twist gymnastic of full body. They are doing aerobic. They are doing Tai Chi to stimulate. Since hand is representing full body, so twisting of this finger, each finger is equal to doing, like, big exercises. Yes, twisting of finger clockwise, anti-clockwise. And don't do it very fast. Yes, slowly, and feel that twist. You will feel the stretch, and when you release, you will feel relaxed. Yes, so all fingers like this, and then come to palm. First is one finger, yes, and then palm, yes, and then this kind of massage. Activate your energy network system in like this, because whole body energy network system is activated. Very good massage. I'm showing all the steps like this, from wrist until fingertip. So all these part of hand you should focus. This is called warming up session. Rubbing, backside also rubbing, back clapping. Don't you know this front clapping for clean surface, but don't neglect this back clapping, side massage, this massage. So this is how your complete energy system is activated. Now, this is not just for knee pain. In all kinds of diseases, before you do correspondent treatment, activate, energize your spiral energy network system. So this is first step. Yes, and this first step you will maintain in your daily routine as part of your hand posture exercise, hand yoga, hand twist gymnastic, hand tai chi. You can say, you can give any name. Yes. Okay. Then second step is, now I'm sharing my screen to show practical part. So my skin is warm now. Very good to do practical session. I hope everybody can see my hand. Okay. So let's say knee. Yes. I am discussing knee. Yes. Maybe in future sessions, I will discuss other joints also. But let us make this knee treatment a very powerful treatment. Yes. All knee pains should go with this kind of treatment. So according to the basic standard correspondence system, this is left knee, right knee. And then we have reflection point, reflection. Just you see, you can see this point, and near this point on this hand, this is reflection point. You see shadow of this knee point coming here. And here also shadow of this knee point coming here. So we have reflection points ready. Yeah. And then round also you can focus a complete joint also if you don't remember this point like this. So we'll mark all these points. This is as per the basic system. And then I have discussed in last session about sitting posture. According to sitting posture, you see when you open these two legs, yes, this is two legs. Yes. So in sitting posture, you see, you can bend your leg in this posture. Just focus leg, only partial focus leg and sitting posture. You can feel your as if it is your real leg because your real leg is like this in sitting posture. Stand, sit, stand, sit. It also gives the glimpse of complete knee direction. All four direction. This has bigger view than standard correspondence system. Yes, this is kneecap, knee area, and this is complete knee area. So left knee, exactly like this is matching with your uh, real knee. You see? Oh my, joint is stuck up. Just a moment. This picture is not moving. Can you see my hand moving? I don't see this movement. No. Yes? No. Just a moment. I'll share again. Okay. No. Yes. Okay. So I'm sharing again. Share screen. Please. Now you can see, yes? Movement. Can you show your thumbs up if you can see? Yes. Okay. Yes. So this is your knee cap. As per sitting posture, we have in basic system, we have standing posture. One is this way, left knee. So when you're focusing standing posture, then just keep your focus on this point. Yes. And this is sitting posture like this. Now we need a probe. So let's say a person has left knee pain, then just one point. Yes, just one point, focus. Sometimes just one, because here we have to focus multiple point. This is big territory. This is big knee area. And here this is very small. So you just on this line, see on this line, this is the kneecap. So now stimulate this point. Now when you stimulate this point, you have to press, again it is stuck up. Just a moment, I have to do it with another. Uh, I'm I am pausing this recording. Okay. Now, just one point stimulation, and how to do it? You see, where you're finding knee point, you press this entire area one by one, keeping probe in perpendicular direction, like this, like this. Not very soft pressure and also not very hard and deep pressure. Yes, and according to the skin also, sometimes old age skin, you have to keep all these things in your mind. Child skin, hard skin. According to that, you can organize how much pressure, but it should be more than surface level soft pressure like this, perpendicular. So 6 to 10 points you have to stimulate here, and after that, whichever point is the maximum painful point,
you can mm, you can make a mark with a pen. You see, in Sujok, this is a very powerful therapy. Only thing is, if we miss the point, we are not getting the result. We just go randomly. This is my left knee. All people know this is knee point. But then they are doing randomly, and then they are doing many seeds, applying multiple seeds on this joint and finishing. And in that journey, that one point is missed. So now this is left kneecap. Now do research. This is also kind of research, and you have to be, you should have patience. You have to feel joy because multiple points. You should not get bored. Now this is your point like this. You can check one by one like this, one by one, all over this circle, and then one by one here. Because this is bony area, that is why you should not press very deep. Just check, 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 one by one. For example, if you have found the painful point, after marking the point, stop. In that case, you should do second step. For example, this is the painful point. Yes, you have done here 10 points and you have checked all the points, and then one point is very painful. Stop here. Stop. And now you don't need to keep this probe perpendicular in this situation because second step is creating vibration on that point, warming up that point. So you can keep your probe like this also. You can do zigzag massage on this point. Yes, or you can do clockwise massage and the clockwise massage like this, creating vibration on that point. Yes, like this, or press deep, release, press deep, release, and then you will fix the seat. Okay. After fixing the seat, your work is not finished. So that was the second step. First step is, and it is this kind of treatment, these steps are not just for knee, but for all diseases in correspondence system. When you find the painful point, after finding the painful point, you have to do all this. Okay. Now, after this, you can do seat, Moxa, needles. We'll do that also. So this is your kneecap. Here you can do ring massage if you don't find the painful point, but we can do ring massage it. Now, second system was the insect system. Insect system, each finger, you are looking full body on the finger. Here, this is back view. This is front view. Yes, face, chest, abdomen, and side are arms and legs. So when you keep your finger like this, simply, this is my right, because this is full body, full body. Right side of the body, left side of the body. And here is the knee point. This is the knee point here. Below this line, on the yin yang line. Top is, this is elbow joint. But our task is now, in this moment, knee, knee. This is right knee, left knee. Below this line. As for the, now I'm coming to second system, that is insect system. Yes. So the same 2 points are available on all the fingers. All the fingers will have. So this is right point, right knee. So if person has right knee problem, as I told you that you have to, play joyfully. This is kind of joyful research. Right knee. So we have multiple right knee points here, multiple right knee points here. So we are checking one by one. When you know in one finger, the same points are available on all the fingers. So you're checking one by one. Press. Don't do zigzag in first step. Yes, in first step, your probe, you have to keep perpendicular. Yes. And 6, 7 points here. Check, 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 check. I'm telling you so that in detail so that you can really experience your cure. Check. You never know where is that point, painful point. When we reach that painful point, it is a victorious point. Random application of seed will not give the result. One seed. For example, I got the point here. Yes, let's say out of all four fingers. Also, I checked after checking all these fingers because here in as per insect system, these are right knee point. Yes, these are right knee point. After checking all the fingers, let's say this is my painful one. After doing this, then I'm doing zigzag, massage. And let's do it acupuncture today. I'll show acupuncture today. Let's do it. Sometimes one needle and pain is watch. So for acupuncture, I'm using this is inserter, and we are using this alcohol swab to clean the hand. Therapist will clean hand, and also you have to clean patient's hand. And this is disposable needle, Sujok needle, micro needles. Yes, and you have to clean. I'll show one by one everything. People, those who are practicing Sujok, they can do this needling, and you can do seed also. So, for example, you have out of all these points, this point you have selected, and now better you can now clean this area. You can clean this. Yes, you know the point, and for your memory's sake, little bit marking is enough. Okay, and then you should clean your inserter. So now, with this inserter, this is available in acupressure shop, easily available. These Sujok needles, this one, very easily available. So we have, you see, this kind of needle. So this back part, this spiral part will go inside the inserter. Yes. And then the direction like this. You can see here. And it is not going deep. You see, it is not very deep. So this inserter has this facility. It looks, this needle looks big, but only, you see, this needle, only this much part. With the gravity inserter, only little part of this needle will go inside the skin. That is why don't worry about that. This whole part, this is the, uh, holding part of the needle, and just this tip of this needle will go inside the skin. So after putting needle, this is the main point. How we do acupuncture. First is 1 point. 1 point is enough actually, but if we feel that I want to give attention to the surrounding point so that I don't miss the main point, sometimes, this is not the main point because patient shouted. A patient should also support us, yes, but a good therapist knows how to find the painful point and how to guide the patient properly so that patient can tell correctly where is the painful point. New patient, when you hold new patient hand, the person coming for the first time for physiotherapy, he doesn't know what is the theory. Yes, you press little bit also, he will shout, oh, this is the point, painful. So that is why you have to tell in detail how to recognize what is the painful point. Yes. So to make it sure, we'll do extra point also, like this, you see. So first is main point and then 4, 5 needles around the painful point. This one, you don't need to do it necessary because today I'm going to show everything. Whatever is good and easy for you, you can select. For this reason, last time I did not take practical because I wanted to keep full attention on the practical part. Like this. So now I'm making a flower around that center point. And you have to keep these needles for 30 to 40 minutes. Now, after giving demonstration, I will remove the needles, but you can keep this needle for 30 to 40 minutes. After removing the needles, you may see one drop of blood also. It is very good. Sometimes you don't have knee pain and still you see the blood is also okay. Sometimes you see blood with knee pain. So actually it is, removing the stagnant energy. This is how we do acupuncture in our clinic. I wanted to show this to you. How we do, uh, you know, treatment of knee. There are many techniques. This is one technique. So multiple points so that I don't miss the point. Now, what we can do, I like to do, especially in old pains. We used only one time or we use it, reuse it. You see, reuse, yes, you can reuse, but you have to take care of this hygiene these days, virus, atmosphere, all. So it is better you uh, use new needles, but if you can take care of your needles, yes, maintain, you can sterilize needles, then you can reuse for yourself. It is just for you only. Yes, no, don't use this needle on other patient. So take responsibility and then you can reuse. So now what I want to do, I want to show Moxa. Moxa. So Moxa, I like Moxa very much, especially in old diseases. This is smokeless Moxa. So this Moxa you can use not just for uh, needle case, but after and before doing seed therapy also. This is Moxa, right? So better to use candle to burn this note. So I want to show all the steps so that beginner can start using it. Use the candle. I will burn this moxa with the help of candle. With the candle, I'm burning. You cannot see the flame, but yeah, here it is flame. Yes, for multiple joint pains, better you do it. Insect system and mini system, one by one you can do. For multiple joints pain, then for serious cases, then we do additional treatment also that is based on the 6 key and tri-origin. So I am making sure that it is burned. So you have to check. Yes. Check, check, check. Yeah, now I can see the smoke. Okay, now it is done. So this smokes are initially when you're burning, then you will see the smoke, but later you will not see the smoke. That is why it is called smokeless moxa. You can use inside the AC, but I always prefer using moxa outside your home. Yes, you can. I will give you question answer session time also. Please focus how I'm doing practical because I'm not focusing your chats now. So you see, especially when you are combining needles and moxa, it gives very good result like this. And if you're not doing acupuncture, then before doing seed therapy, you can do moxa on the knee joint, on the knee joint. And now how much time? You see, until your skin becomes warm. Now I'm showing just one point, but same thing you can do on all the points. But don't rush quickly. That's what I noticed in some young practitioners. They quickly do like this, 1 to fast, 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 fast. No, not like that. You should have patience. If you really want to give result, if you don't have time, then you teach your patient how to do it. You can advise him. First day you give demonstration how to do moxa, and your patient will do it at home. You can do acupuncture part and other part like this. You can do it nicely. And you remember, I also discussed that. Don't neglect the lumbar point. If person has disease below the diaphragm, it is very important to focus lumbar points. Nicely, massaging of lumbar points. And doing, after massaging, doing moxa. You can make spiral pattern while doing moxa. It's very good. Our energy is moving in spiral direction. Yes, like spiral moving like this. Checking all the points. After that, doing moxa on all the points. The best thing is, in all old diseases, I always like to do foot also. Yes, like this is foot. So in foot also, let's say this is a right knee, and then on the right knee also, you do this moxa. And this knee treatment on the foot is very powerful. Then on the lumbar zone, here is the lumbar zone, like this, front and back, below the, you see between the legs, middle two fingers are legs, and central line here, front and back. And the nail of that finger is, yes.
I have a query here. For example, the knees are very warm or hot. Can we do
Mhm.
moxa?
No. When you see this kind of situation when knees are warm, don't do moxa, especially in acute arthritis, inflammation, heat. Don't do moxa. So that is why I said that in all old cases, I love to do moxa. Old cases, years and years of knee pain. It's very good to do moxa. And after some accident, yes, local accident, some surgical situation, in that case that is called as excessive. In that case also, before doing seed therapy, you can do moxa. But in inflammation, and when you see this skin is warm, yes, on touching the skin of knee you feel warm, then don't do moxa, but you can do other steps. Okay, so do good moxa, and then this is moxa extinguisher. You can do this way, or with little water you can extinguish this moxa. Okay, now this is one thing you have to do it. And for example, now let's say 40 minutes passed, and now I will remove the needles one by one. One by one drop. Yes. Now at present, I don't have that knee pain, but one drop blood coming. Okay, it's okay. Maybe some chi stagnant. It is now uh, solved. And don't worry about that blood. We always feel good after this one drop of blood. Okay, then clean this with a swab. This is one technique, needles. And then let's talk about seeds. I like seeds, these fenugreek seeds. These seeds are matching with the bone, and it has medicinal property also. Generally, you see that many people they drink methi water. This is fenugreek for joints pain. This they eat also. They make water of this. They soak it in at night, and then morning they drink water like this. Little bit of seeds, soak it in one glass of water, and you drink early morning, empty stomach. That is good for joints pain. And in Sujok also, you can use this seat. So now let's say, and also on one point, if it is one point diagnosis, that is again very good. If you have reached this one point, then black pepper is good. Let's say like this on the point, black pepper, 1 point. This is 1 point diagnosis. For example, after checking all the points you found here, then you can stick one black pepper. Or another way is like right, for example, right knee, just randomly. This is target 1 point, but to support all the direction of the knee, this is left knee and this is right knee. Now, example is of right knee. So better we do or do it on the right hand as first choice, but for me it is easy to stimulate. I'm working with the right hand, so I'm using on left hand stimulation. And then see this kind of practical. I want you to focus. It gives very good result. After doing brain massage, then cover this joint. Practical part is also one art. And now I will overlap with this so that my seeds stay intact, compact, like this. And then press. Yes. So don't leave patient hand before, or I can say don't leave patient hand until you press nicely. So after fixing the seeds also, press at least 2 to 3 minutes. Or you tell your patient to press and then tell him to go. Okay. Because after warming up, seed releases a very good healing energy that we should not miss. And after warming up the skin with the probe, with Moxa, with the ring, and immediately when you tie seeds on that joint, yes, seed releases its energy. That is why don't leave it randomly. Give attention, and after 5 minutes of pressing, then you can tell your patient, press from time to time. Yes, you have to keep these seeds for minimum 6 hours. You can keep for 24 hours also. No problem, no side effect. Only thing is how much time your skin can tolerate. It is as per your skin condition. Some people they have sensitive skin. Then for them we always tell them, okay, when you feel discomfort, just remove it immediately. Slowly, slowly, when he will do it every day, then the skin will accept and then he will allow to keep more hours. But don't give discomfort, and you can simply tell your patient, you can, ideal time is 6 to 8 hours. And if you feel discomfort, you can remove before also. And then second day, you can do it again and slowly, slowly you will see patient's skin will start adopting this and will follow our technique, 6 to 8 hours, our pattern. So this is how we can do. And now this is, for example, right knee. I have right foot. So same thing. This is right knee. Copy paste. This is the right. So this is the right foot. Okay. This is my left hand. And let me see my left foot. Okay. See how to find in the foot. This is my left thumb, this direction, and big toe is also this direction. Easy. If you recognize in the hand, foot is the same. Okay. Now, this was your right leg. Okay. So near the little finger was your right leg. Same in the foot. Same foot you choose. Big toe is this side. This is my left foot. This is my left hand. And in left foot, left hand, I am searching right knee. Yes. So near the little finger is right knee. In this foot also, near the little finger is right knee point here. So you can do ring massage here. And then same technique, you can fix seeds here in this area, and then press it the same way. And then after pressing, you can tell your patient to press from time to time. So this is called insect system, basic system. And now let me focus mini system. Yes, mini system, again, very powerful system. Now you know that in Sujok, this is left arm, left hand, left arm, left leg, right complete leg, and right arm. Okay. So as per the mini system, you see this is left upper arm, left lower arm, and this is left hand. Center line like this, and here you will find finger area. Small hand, tiny baby hand, thumb, index finger, middle finger, ring finger. And we have joints here. This is knee joint. This is knee joint. You see joint here. We have joint. So stimulate here. This is right. This is left knee. See, same copy paste of this hand is here. Thumb is this side, thumb is this side. This is big system, this is mini system. And this is index finger. Here is index finger, middle finger. This is middle finger. This is left leg and this is right leg. So we go to ring finger here. And here is the little finger. So here you have to stimulate the front side. So you can, if your target is right knee, this is how you can check in mini system. I'm giving an example in just one finger, and then all fingers will have same story. But here we will have foot, and here we will have hand design. And on the back side, exactly on the back side, just come below because nail also has point, you can press this, but we cannot tie seed here, but we can do moxa here. Then come below on the level of root. For example, this is right knee. Come back side here, and then come down in the same line and press gently. Here, don't press deep because it is very sensitive area, bony area. Press, press, and just one fenugreek seed is enough here. You can check all the points of mini system. This is dummy case. So let's say I have painful point here. You can check all, and I have painful point here, like this. You can do it. Yes. Then, next thing is, I want to tell about Meridian Sujok. Pain symptom. If patient has pain symptom, before doing seed therapy, you can do pain management technique. And of course, in 10 patients, 7 patients will respond to this. In chronic cases, we have to add this correspondent treatment for sure. But to remove pain for pain management, before you give a painkiller, try this. How to do it? Let's say this is my right hand and right knee case. We are discussing right knee case. So in right hand, this is my right leg. Right leg. This is my kneecap. Kneecap. And as per Meridian, on the inside, just near the kneecap, this is clean meridian running near the kneecap. On the front side, spleen meridian. And on the back side, you see this is the nail line. This is stomach meridian. So knee is in the center. 2 meridians are there. On the inside, spleen meridian is there. And on the yang side, stomach meridian is here. So you can simply, even if you don't know the direction, you can simply try with the bar magnet. Sedation technique is first. As per energy flows from arm to leg. You can keep like this, white face. You can start with this first. Okay, even if you don't know complete Meridian Sujoki, but as a simple baby tip, your nail is white, and this bar magnet also has white portion. So these two white like neighbors. So keep your magnet like this. This is in our science, we say this is sedation, but doesn't matter if you don't know sedation or tonification, but you can just keep like this. If your pain is good, if your pain is decreased, then this is suiting you. And then you can tell your patient to keep for 1 hour or 2 hours. And also you can tell your patient as soon as pain is removed, you can remove this your pain is gone, you can remove this bar magnet. Sometimes in 1 minute pain, leaves the body. Sometimes 1 hour, 10 minutes. So give time to him. Tell him 2 hours maximum. But if you feel relief before 2 hours, you can remove the magnet. So this is in our technical language we say sedation of stomach meridian. But you know what happens sometimes? As soon as you keep this magnet after 1 or 2 minutes, patient knee pain aggravates. It is not side effect of this. It is like energy speaking to you that your magnet application is good, but you need to change the direction. So better you change the direction. You just reverse the magnet because pain is decreased in your right knee after application is a very good sign that your magnet is working. But only thing is you have to change the direction. So previously white was facing the white nail and now reverse like this, reverse. And then you can again check, yes, and tell the same thing. Maximum 2 hours, minimum. As soon as you see the result, you can remove the magnet. Yes. And if he doesn't see any change, then try spleen meridian. Front side is spleen meridian, and in spleen meridian, uh, white facing the base, the palm here. This is sedation, or yellow facing the tip. Yes, in this case, we say this is sedation of pain. So same story continues here. If patient gets a relief, is very good. You can tell patient to keep for uh, 2 hour maximum and can remove as soon as he feels a relief. And if if pain aggravates, that is also a good sign because aggravation tells that magnet placement is good. Only thing is you have to change the direction. Change the direction. So whenever patient has pain, you use this Meridian Sujoki. But if patient has no pain now, but medical report is showing that disease is still there, then this correspondence system treatment you have to continue. Along with this bar magnet, you can continue this. Yes. Some people they will get result from this, some people they will get result from this. And you can continue this for few days. Every day you can keep. Sometimes patient will say, Doctor, I am not having pain at present moment, but evening at time I have pain or morning time I have pain. So you can teach your patient, okay, you just like, SOS. You keep this magnet like this and check this direction. Start with this first and then do it, reverse like this. All the story you can explain to your patient so that he can use this painkiller. Like this is like painkiller. Yes. For senior therapists, we have complete package of algorithm. We do it, but now for beginners, I'm telling in a very easy way, like this, you can do it. So this was like Meridian Sujoki. And then I told you to pay attention to lumbar points also. Lumbar points, you can do magnets or black pepper. I always like to do magnets, seeds on spine area. In all chronic cases, I like to do treat spine. You can choose insect system, you can choose mini system, that is your choice as per your time management. If you have good time, you can search the painful point for these points, these areas. For knee, you have to check all the painful points for sure. But this you can do massage. After doing good massage, you can attach this lumbar area because nerves coming out from the lumbar area. Yes, it is uh, in our body. It is touching knee, supplying energy to the knee. This is in basic system application, and then in insect system we have small area in lumbar. Always do lumbar point for leg pain, knee pain, ankle pain. Always you should do it. This is how we can do lumbar in insect system. Whatever you feel good, easy, you can do it. But nicely do it. Massage, same way. Don't fix magnet or seat randomly. Massage before you do this. Yes, this is lumbar. And then, as per 5-step treatment, we stimulate brain point also. Master point, brain point. Kidney point stimulation for all leg diseases here. Uh, I also like because this is like detoxification, kidney points, very good. And fix like this with the help of paper tape, kidney points. And for 60 participants, they know that dryness meridian, large intestine and UV meridian connected with the dryness energy. You can select dryness, 25 feet in that, and you can inform if it is new, and if it is chronic, then you can do on the game meridians. So that is 60 for 60 participants. But triogen tip, I would like to add, beginners can also do. Triogen treatment is very simple. Of course, yes, you know, you should have consciousness, but still, many times in simple way also triogen is helping. So all joints are neutral, all joints are neutral, all extremities. When we see full picture of triogen, I am giving just a simple baby tip. We have a complete chain system. So this finger represents neutral force. All right, let me do it. You will not do everything. And now I'm teaching all patterns. That is why you see many strips on my hand. But when you do it, you can choose, you can select, or wherever you find a painful point. But sometimes we do force powerful treatment also from beginner's point of view because we don't have a detailed understanding from energy world. So we can do this multiple treatment also. If patient allows and he's not going to the office or not working, you can do multiple treatment also. So this little finger is connected to our joints, all joints. Yes, when we talk about extremities joints, then a knee joint, this is or elbow joint. These are hetero part of neutral. So this is the joint. Whether you see this finger or this finger, this hetero joint is knee joint. Yes. So you can give good moxa in old diseases, not in arthritis or inflammation. So you can massage this nicely, ring massage, moxa. Then after that, you can fix seat, you can fix magnet in 4 direction like this, 4 direction or seats. Overlapping so that it stays like this. Okay. So now I hope you'll be able to do it. It is not very difficult. Okay. So now I'm sharing my video. I don't know why it is not coming up. Trying again. Give me 1 minute.
Yes,
Maybe
ma'am.
I leave the meeting and join again so that his color I will tell. Just give me 1 minute. I will rejoin and I will stop the recording now.
Yes,
Pause.
yes, ma'am. And it is 9:36 already, so you can join and will you be able to answer at least two or
Yes,
three?
yes, yes. We'll have question answer session now. So
Oh,
I want to rejoin so
yes,
that
please.
my video opens. Now you
But
can
I
start.
didn't.
Yes, now
And
you can
ma'am,
start.
in every session, do you take different types of injury? Means organs or related to?
Yes, we keep taking. Yes, whatever disease is very common, we take and we touch many topics. And in coming time, we will touch topics related to present famous diseases.
Good evening, ma'am. Nice
Good
topic
evening.
today.
Good evening.
Ma'am, I'm having only in the night needs stiffness, ma'am. During the sleep, I cannot bend. Once I relax after 20 minutes, I'll turn out, then I'll bend the knee. Otherwise, I'll have calf muscles pain also.
This is like wind
Then,
color. You need to apply, yes, you need to apply green color on the knee joint. And then, of course, moxa seeds. Not like this, not like this. You have to make a ring, very neat and clean ring, not three dots. You see, like this, line, neatly, neatly. Make a ring covering 4 direction. Do moxa, do seeds nicely. And on the other hand, you can do color. Combination, seed and color. And just follow all these tips, whatever you have learned today. Yes, please. Yes. Oh, you have started doing your treatment. I can see strips on your
Yeah, good
fingers.
evening, ma'am.
Good evening.
Ma'am,
Very
your
good. Good
smile
spirit.
is very, very interesting, impressing, ma'am.
But your
I'm
smile
started
is
doing
also
smile
very.
meditation also.
Oh,
And
wow.
I'm trying to smile like you, which is not possible.
No, you smile so beautifully.
Ma'am, see, as you were telling, I did this. Can we put like this because there is intestine also, gallbladder, everything. So can we put like
No,
this, ma'am, for the entire?
see, I want to tell one thing. Don't pack your fingers like
Okay,
this. You
okay,
see, you have to make a target here. Like this. This is your knee joint, for example. This way. If you
okay.
pat your complete finger, thinking
Hmm.
that, oh, I will with this technique, I will touch intestine also, I will touch this organ also, and let me do it multiple points. We are blocking the energy. Paper
Okay,
tape also has its own energy because of
okay,
gum. Paper tape has gum, and then multiple wrapping of paper tape. You see, many energies are flowing. We are blocking that area. So don't
okay,
do. So I did multiple treatment because I was showing variety of points. But just make
okay,
a focus and do on one finger, at least do one treatment. Don't do multiple points on one finger. If you want to
okay,
do intestine points, do it on the other finger.
okay. Ma'am, like this, you asked us to put the ring. Suppose I have swelling on my knee, then in the middle I have to put dark blue and then red ring I have to put
No, 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 no. Not. I have not said dark blue. I
only for
said green in the
dark
center
green. Yeah.
and red, dark green,
Okay.
and then red
Ah,
outer area.
okay.
People, those who have 6 key knowledge,
Ah,
they know the swelling is like humidity. They can just
oh,
put green color.
okay.
Inflammation is heat. They can use 6 key consciousness, like inflammation of heat. Then they can put red. Sorry, this is red disease. So we can put opposite of red is brown or blue. Dark blue we can put like this. So if they have like after accident, immediately they see some accident, swollen knees, big expansion immediately. This is hotness phenomenon. And here
Okay.
you can put dark blue color like this. So with
Ah,
6 consciousness or with triune consciousness, you can put, yes, but for triune consciousness, actually it is very easy for beginners if you have inflammation or some warmness there, then this is like fire type of thing. Then you put water type of color, that is homo color, blue color. Rigidity, stiffness. Yes.
okay.
Here
Okay.
you can put red or orange color.
Okay. Thank you, ma'am. Thank
Yes. Next question.
Hello.
Yes, we can hear you.
Thank you, ma'am. Thank you very much. Ma'am, can we solve synovial fluid problem?
Please do it. We can do it. Yes, we have to add 6 trial consciousness, but then with this all these technique, you will see change. Step by step,
So,
you will see change. As for beginners understanding, you have to follow these techniques and you will see the change slowly, slowly, but yes, for sure.
so by this technique, we can solve our synovial fluid problem also.
Yes, it will take little time, but yes, because I have told as per beginners consciousness.
Okay. And while walking, we get cut noise.
Correct. This is dryness energy. That is why green and red color is very good for your knee form.
Okay. Okay. Thank you very much, ma'am.
And in foot also, don't forget. In foot also. And keep seeds for 6 to 8 hours every day, daily. You can keep changing the hand because skin is sensitive. If you do it on the same finger every day, then the skin, that surface of skin becomes dry. Better you do it on the other hand next day. Alternate, you can do like this. No. Yes, please.
Namaskar, madam. Yasmin
Namaskar.
here. Your lecture was really very interesting and very easy to understand. And I have my knee problems, so I have just applied I selected the points, and there is a cluster of points paining here, so I have put a cluster of methi seeds there. And here there is a line I have put like, because
Yes.
that joint is
But,
paining.
yes, but I cannot see. I don't know which consciousness you have used for insect. Is it insect system or wings?
This is my right knee, which is operated, and that joint is paining. My femur is fractured, so that joint is paining, and I have selected a cluster of points here
Okay.
on the inner side, and it is
Mhm.
paining where I have applied this cluster of methi seeds by selecting the point, which were painful points I have selected.
Okay. So,
And then
like,
here,
yes.
inner line I have made this thing, because that inner complete behind the knee, that joint is there now. That
Mm.
soft part
So,
of the knee, that is also
understood.
paining.
Understand. So you have to be very clear. You are using basic system or insect system in basic system. Like you said, right knee? Which knee you said?
Insect system,
No,
finger.
which knee? Left or right?
This is right knee, ring finger.
No, no. In your main body, you did
Main body,
for
my
right
right knee.
right
Right
knee.
knee.
Yes.
On the
So
left hand is the ring finger, and
this is the right knee.
right knee.
And the
And this,
kneecap is facing the little finger as per the basic system.
yes,
Don't
yes,
forget this. Facing the
yes, yes,
little. Perfect.
yes.
Okay.
And this is my left knee, which is the outer joint is paining, so I have put the seeds here on the outer joint.
Left knee is facing the index finger. According to basic standing correspondence system, left knee cap is facing the index finger. Don't forget this. But I don't
Okay.
see their point.
No, no, it is not paining on the cap. It is paining on the inner side.
As per the painful point, you have one.
Yeah, I
Okay,
have
fine.
selected the painful points.
Okay.
Okay,
And
thank
don't
you very
forget to
much.
do, yes, don't forget to do ring massage from time to
Yeah,
time.
I did that. And I used the points. I have got both these things.
Very good. Excellent.
Thank you. What was available with me on the table, I used and I did it.
Very good.
Thank you so
That's the spirit. That is the spirit. Very nice. Thank you.
Smile, thank you, ma'am. Smile, gratitude for all the sessions. And I'm sending all the gratitude from all of our participants. It was only 1 hour class, but you made it 2 hour class even after the time was over. So thank you so much for your
Thank
time
you.
and dedication and passion for teaching, ma'am. We all are sending our gratitude and heartfelt thanks and gratefulness for this wonderful session of practicals on knee pain, ma'am. Gratitude, gratitude, gratitude.
Thank you so much. Thank you so much. I wish that you all are, the knee pain is gone.
Yes, ma'am. Thank you so much. Smile, thank you to all of you for joining this wonderful session. And let us meet again in the next session. Please keep a check on all the groups for all the sessions. I immediately want all of you to go back to the group and share your feedbacks, please, without fail. It's already late, so I'm not opening your mics. I'm sorry about it. Thank you so much. I'm sending all your gratitude to ma'am and smile good night. Smile good night, ma'am. Thank you. Ending the session, everyone. Bye.